5, 4, 3, 2, 1. Let's go. Diary of a Kidney Warrior podcast in partnership with Kidney Care UK, sharing faith, knowledge, hope, and love.
Hi, and welcome to Diary of a Kidney Warrior podcast. My name is Dee Moore, and I am a kidney warrior. This podcast is dedicated to encourage, educate, and inspire as we explore all aspects of kidney disease, related chronic illnesses, and health. If you have any questions or ideas for topics you would like me to cover, please get in contact with me on social media using the handle Diary of a Kidney Warrior. My guest today from Bristol, England is Clinical Psychologist Dr. Roz Cooper. Dr. Roz works with children with chronic kidney disease and their families in the southwest of England. Dr. Roz joins me to share about managing uncertainty. Hi, and welcome to Diary of a Kidney Warrior podcast. How are you doing today, Dr. Roz?
I'm very good, thank you. Dee, how are you?
I'm good. I'm looking forward to our interview today. So our episode today is part 4 in our series where we've been talking about uncertainty. We started part 1 of this series in episode 109, which featured Dr. Jan Dudley, where we talked about uncertainty as a woman pregnant with a baby, finding out that the baby has issues with their kidneys. We then talked to Kay Allardyce about her pregnancy as a woman with CKD and the uncertainty she experienced in her pregnancy. We then spoke with Reginda as a mother, finding out that she was pregnant with a baby who has kidney issues and the experience that she experienced in her pregnancy. So we've looked at uncertainty in different aspects from a clinician's point of view, from a parent's point of view, and also in terms of the child having CKD, and then also pregnancy in terms of the mother having CKD. So we've looked at uncertainty from different aspects, and I thought it would be a really good way to conclude this series by speaking with a psychologist such as yourself, Dr. Roz, and be able to really explore and unpack the subject of uncertainty, but also come up with some strategies in order to deal with it. Because, you know, I'm a very practical person. When it comes to Diary of a Kidney Warrior podcast, we're not afraid to explore and look at different topics, but we want to do so with solutions in mind. You know, it's like, okay, this is a challenge, but how do we manage that challenge? So today is dedicated to that subject and looking at how can we deal with uncertainty. So yeah, after saying all of that, I'm really excited about our final part in the uncertainty series today. I wanted to start with the basics actually, because we've talked about uncertainty, this being the 4th episode now of this series, but actually we haven't actually defined truly what uncertainty is when we're talking about this topic. So my first question is, what do we mean by uncertainty?
That's a really good question. And I think this is something that people are exploring more and more. If you think about the recent past few years with the COVID-19 pandemic, uncertainty has become a bigger topic for people generally to talk about and explore. And I guess if we go really back to the basics of what it is, it's not knowing. So being unable to predict an outcome in some way, or something that you can't be sure about. And in the context of a medical condition such as CKD, often that's related to some kind of ambiguity about what will happen, or unpredictability, or often related to complexity in terms of different potential outcomes or options in some way. So I guess really generally that's what we mean when we kind of talk about uncertainty within the context of a chronic medical condition.
And how do people experience uncertainty?
This is a really interesting question as well, because if we think about really general uncertainty, in and of itself, it's not necessarily always a negative thing. So if you just think about uncertainty in general, there might be situations in life where actually uncertainty could be seen as a good thing. Or if you think about, I guess, how different people experience uncertainty in general, everyone has their own level of tolerance when it comes to uncertainty. So we can probably all think about people that we know in our own lives who love surprises, who would love to have a surprise birthday planned, or really like the unknown of like a surprise gift or those kinds of things. Other people absolutely hate that. But even on a level of something like a gift or something that's planned, which may just be entirely positive, uncertainty for some people can still be really difficult. But then obviously when we're thinking about CKD or chronic health condition, then we're adding in a real threat potentially to that. So when we've got uncertainty combined with a real or a perceived threat of some kind and disruption to life, then that can really understandably cause distress and anxiety. And we know that that's really understandable given that the uncertainty is very real in CKD. And that actually, if we think about how our brains work, how our brains have been wired over thousands and thousands of years of evolution, actually our brains are kind of programmed to respond to challenges through problem solving and to look out and respond to threats in a way that tries to resolve things and come up with solutions and find certainty, because we can equate certainty with safety. So if you think back to when we had to hunt and gather our food, when we lived in communities where there were those sort of risks around predators and lack of food and those kinds of threats, actually we survived and continued as a species by being very, very good at problem solving. So identifying threats, trying to solve problems. And that's really helped us and been incredibly useful in many ways for a very long time. But that means that our brains respond to other kinds of threats, such as uncertainty, where there is that really uncertain but potentially difficult kind of outcome, in the same kind of way that they're trying to problem solve and think through something that is not necessarily possible to solve because we don't know the outcome, if that makes sense. And that's where it can be really, really difficult when we experience uncertainty day to day. So yeah, if you think about the bit I've just said about, how our brains are wired to problem solve and find solutions. And the thing that sets us apart as humans from lots of other kind of animals, as far as we know, is that we have brains that can think into the future and imagine what might happen in the future. And part of that comes from our ability to use words and language and pictures and imagine and create. And again, obviously, all of those things are brilliant for many reasons. But the difficulty with that is that our brains can then create images and ideas of things that may or may not happen in the future. And because our brains can find uncertainty very difficult, they can then create scenarios. We just don't know whether those scenarios will play out or not, whether they'll happen or not. And that can lead to worry. So those kind of what if thoughts, what if this happens, what if that happens, about future events that may or may not happen. And so that's how uncertainty can become really difficult when those thoughts occur. But also that is to say that, again, this is really normal, that our brains do this in a really understandable and normal way. So I think often one of the first things that I would say to people who talk about struggles with uncertainty is it's so understandable and it's not your fault if you find this difficult.
There's a lot to unpack there. So touching on what you said earlier in terms of a simple thing like a surprise birthday party, two people having literally opposite reactions to the exact same situation, one person being really excited about it and the other one like the worst nightmare type situation. And that is in terms of something positive. But for medical situation where there's a lot of difficulties that you've got to overcome, two people in the same situation could be handling it very, very differently. And for some might find it very, very, very stressful and difficult to do. And I have to say a disclaimer with this episode, the information that we're sharing is for educational purposes only. It's not to replace your medical care. Let's put that out there. I encourage you in matters of your mental health, please do seek a renal psychologist to get your personalized care. So have to start with that disclaimer. Today, we are going to be looking at strategies in terms of managing uncertainty. And this is generic advice. Like I said, for your personal situation, please do seek support from your renal team. We're going to look at the strategies now. What are good strategies for managing uncertainty?
So I have a few ideas I'd like to share, and I'm sure that listeners will relate to some of these more than others. So with all of this, please just pick and choose what you think suits you best and fits best with your own way of managing things and your own circumstance. But they're just some ideas that other people can find helpful. So one of the things, if we think about worry, and we've talked about how worry and uncertainty are really linked because of that future focused thinking that our brains can often slip into in uncertain situations. We know that it's really, really difficult, if not impossible, to stop or change our thoughts. So I don't know if you've heard about the white bear experiment, Dee. If you've ever tried that.
I haven't heard of the white bear experiment. Please do tell me about that.
So the white bear experiment is if I said to you, okay, I'm going to give you 1 minute and you can think about anything that you like, anything at all, as long as you don't think about a massive white bear standing in the room in front of you. And obviously, we're not going to do this exactly because a minute pause on the podcast would not work. But if listeners want to try this, feel free to pause for a minute and give that a go. You can think about anything you want, just don't think about that massive white bear. But if you do think about the white bear, I want you just to write down on the piece of paper a tally of how many times you think about it. Do you want to try it just for 10 seconds?
Okay, let's go for it.
Okay, go. How did you get on?
4 times I thought about the white bear.
Yeah. So that's what our brains do, right? I've never met anyone who can't think about the white bear once that's there as a suggestion. Your brain is actively trying not to think about the white bear, and therefore you're thinking about the white bear. And it's the same with our thoughts in general. If we try and stop or push away our thoughts, it's almost like we use a lot of metaphors in psychology. You imagine you were in a swimming pool or in the sea and you had one of those massive inflatable balls, beach balls, and you were trying to push it down under the water. You might be able to do that for a few seconds, but it would very quickly become very tiring. And before too long, that ball would pop up out of the water and create a massive splash. So you might be able to do it for a little bit, but it will be very, very tiring and it won't work for very long. And it's the same with trying to repress or stop our thoughts. And so this is where worry can sometimes become even more difficult, where we try and push our thoughts away. And you might have people might say, trying to be helpful a lot of the time, oh, just don't think about it. Just don't worry about it. Just don't think about the future. And we know because of these experiments here, that's very much easier said than done. And so a different way of approaching it, if we know that pushing things away or trying to stop thinking about things doesn't help and doesn't work, is to try and think about, okay, can we change our relationship with those thoughts? That maybe we can't get rid of them. Maybe those worries and thoughts about the future might still be around, but is there a different way of relating to them so that we can continue to live our lives in a way that means that worry doesn't overwhelm our day-to-day lives, and we can still do those things that we really care about in whatever situation that we're in and that are really important to us. So one strategy that can be quite helpful is called unhooking. So unhooking from thoughts, or you might also hear it called diffusion. So diffusing from our thoughts. And this is basically creating a little bit of distance between what our mind is telling us and how much we latch onto that thought, how much we're hooked by those thoughts. So it's the difference between having a thought that could be something like, let's take a sort of general example. I'm rubbish at doing this task. So you might get that thought that comes up, I'm rubbish at doing this task. And if that thought feels very close to you and very true, again, understandably, that might not make you feel great. And then you might just not want to do that particular task. Whereas if we add in a little bit of that distance, so adding on to that sentence, I notice I'm having the thought that I'm rubbish at doing that task. Suddenly that can feel a little bit different and just a little bit more distant from just taking that thought as it comes at face value. And that can work for worries about future events as well. And I think one of the main unhooking strategies is to notice when those thoughts are coming up in the first place. So to notice, okay, that's a future focused worry. My mind is giving me this worry about the future. Or my mind is giving me this worry about an uncertain situation. Noticing that that's happening. And then coming back to whatever's going on in the here and now. And we can talk about some ways of doing that as well. Because again, I know this is all very much easier said than done.
Yeah, this actually reminds me of when my children were younger. I mean, they're grown up now, but when I would tell them off, rather than saying, you're a naughty boy, I would say, I don't like your behavior, what you did, and then explain what was wrong in terms of their behavior. So for me, it's like when you say you're making that their identity rather than what's happening in that moment or what they've done. So in the same way, if you're saying, I am rubbish at X, Y, and Z, you're making that your identity. Whereas when you're doing what you're saying in terms of that diffusion or distance, it's like, I notice that this is how I'm feeling, but you're not necessarily then owning that feeling as being your identity and then becoming it. It's like, I see that I have this feeling and I've now got a choice now of what I'm going to do with it, as opposed to this is what I am and I become it.
Exactly. Yeah, it's exactly that. And I'm sure lots of people would have heard about this idea of mindfulness. It's out there a lot. You probably heard about it generally, maybe read or watched things about it. But actually, this idea of mindfulness is basically what we're talking about here, that mindfulness it's not about trying to stop our thoughts or clear our brain of thoughts, because as we've talked about, that's very difficult, if not impossible. But mindfulness is about noticing where our thoughts are, noticing what thoughts might be coming up, and then redirecting our attention back to something in the present moment, rather than getting on that thought train, that spiral of thoughts that can take us into the future, which is not happening yet and may not play out in the way that our mind might be telling us that it will anyway. So thinking about how to become mindful in the present moment, there are some really simple but very effective exercises, such as coming back to our senses. So often if our minds are caught up in worry and thinking, almost like the opposite to that, so like changing gear in our brains in a way, is to focus on our senses. So what can you see? What can you hear? What can you smell? Or coming back to what's happening within our bodies. So how are we breathing? What can we feel in the room around us where we are? So a simple exercise is called 5 senses, where you can do this anywhere. You could be queuing in the supermarket, stuck in traffic, wherever you are, but thinking, okay, what are 5 things that I can see right now? And you can make it even more specific than that by maybe thinking, what are 5 green things that I can see? And listing them to yourself. And then moving on to what you can hear. So what are 4 things I can hear? And then what are 3 things that I can touch or feel around me? What are 2 things that I can smell? It becomes a bit more difficult at this point, but in a way that's good. And then finally, what's something that I can taste? And I often say to people, you can cheat at this one and just have a sip of water or, eat a mint or something if you can't taste anything naturally in your mouth at that time. And that can just be a really helpful exercise just to ground back to the here and now and go from that thinking part of our brain gently back into the sensing part of our brain. And actually, just thinking about sort of day to day as we go through our day, there are a lot of pretty mundane activities that it's quite helpful to try that in. So even thinking about things like brushing your teeth, doing the washing up, washing your hands, those kinds of day-to-day activities that we often naturally do on autopilot without thinking about them. Or often that's when our minds are thinking a lot because they're autopilot. We can then really focus in on those different sensations, those different senses. And that's quite a nice way of bringing that mindfulness into our daily routines without necessarily having to carve out, 10, 15 minutes per day to do that in silence without anything else going on that I know is unrealistic for a lot of people.
I really like what you said in terms of grounding and focusing on the here and now. And I think having a strategy that helps you focus on the here and now and what's in your power to control is so powerful. And I think that's a really good strategy. Okay, you've shared like some brilliant strategies so far. I'm greedy. I want more and more. So what else have you got for us?
So another strategy that lots of people find helpful that will sound a bit strange when I describe it, so bear with me, is called scheduling worry. So this is where you pick a small amount of time each day that you would designate to be your worry time. And if possible, trying to, again, I know this would be difficult for some people, but if possible, trying to choose roughly the same time and duration each day. And again, if possible, trying to have that free from distraction. So having that time on your own, preferably somewhere quiet. But again, it might not be perfect and that's fine. Not just before you go to bed. That's the main rule here. So trying to do this at least, an hour or 2 before you go to bed. And this is your designated worry time of the day. During the day, when you notice a worry or when you notice those uncertainty related thoughts popping up, then what you could try and do is to just briefly either jot it down in a notebook or a piece of paper or write it on your phone, put it somewhere if possible. You could even record yourself a voice note if you prefer that to writing things down. And then just remind yourself, okay, you could say something like, okay, thanks, brain. Thanks for giving me that worry. I will worry about this later. There are other things for me to be doing right now. And then you could use some of those mindfulness strategies we've just talked about to bring yourself back to the present moment. And then when you get to your worry time of the day, that's your chance to look at those worries. And it's going to sound very strange, but just let yourself worry. You can have that time to think that through, think about those worries. And for some people, they might also want to combine this with another related strategy called the worry tree. You can look this up if you just Google the worry tree. You'll find templates for this online. But it's basically a way to help distinguish what worries can be solved in some way. So what are the things where actually you could do some problem solving, whether that's things that you can do yourself or seeking support from others to find solutions to some of those worries. And again, that's really going to depend on what the worry is and your individual sort of preferences and style. So for some people, finding out some more information, that in itself might be helpful, even if there are still unknowns and uncertainty. Sometimes some people really appreciate having as much information as possible. Other people do not like that at all, just want to know the bare minimum or not very much until the time comes for more information to be needed, if that makes sense. But some of those ideas around problem solving might be in the context of CKD. It might be, what questions do I want to ask at my next appointment? Do I contact my clinical nurse specialist to ask some of those questions, or do I wait until my next appointment? Those kinds of things can be helpful to think about. And so the worry tree distinguishes those kinds of worries that can be resolved or problem solved in some way with the ones that can't be, that are the very future focused ones that can't be problem solved in a practical way. And so by using the worry time for those worries, you've got that designated time where you might be worrying, your brain's trying to do its problem solving around things that can't be problem solved, but you've got limits in the day to that. So you might want to even think about setting a timer. So maybe I wouldn't say more than 15 minutes, 15, 20 minutes, maybe even only 10 minutes for worry time. When that timer goes off, trying some of these exercises to bring yourself back to the here and now, and then having a bit of a plan for what you do next. So it might be making dinner, and whatever would naturally come next in your day after the worry time, where you can come back to the here and now. And the idea with this, as I said, it sounds a bit weird, but actually over time, and it probably won't happen the very first time that you try this, but over time, for lots of people, it becomes easier to pause some of those worries during the day, knowing that you can focus on them later on, and contain the amount of space that they take up in your day from potentially the entire day to a smaller amount of time, which more concentrated, but actually it can then become easier to postpone some of those worries, so that if you think about the day overall, they take up less of the time. Does that make sense?
I really like that, because you're not throwing those thoughts away or brushing them under the carpet and not dealing with them at all. And then those are building up subconsciously in the background and causing you stress. But you're actually giving time for that, but also freeing yourself from the worry of not worrying.
Yeah.
And in doing so, you're saying, actually, I'm going to have this time to think about it, and then still using strategies to deal with it. So you've got the time to sit there, worry. It's a structured amount of time to do it. It's not taking over your whole day or your whole night, because you're not doing it before bedtime. You're not doing it first thing in the morning, but at the start of your day. It's at a time where you can give it the time to think about it, and then have the strategies once you've done it to deal with it. I absolutely love these strategies. And do you have more strategies?
Yeah. So I probably wouldn't call this one a strategy particularly, but as a general approach, something that can be really unhelpful, again, when people are experiencing uncertainty, as well as in lots of other situations, actually, is to think about what your values are and to spend some time working out your personal values. So values are overarching ideas or concepts that we all hold that are basically the things that are most important to us in our lives. And they tend to be one or two words, and they tend to be quite broad. So an example of a value might be being compassionate to others, or it might be being helpful, or humor could be a value. Somebody might say, I really value humor in who I am as a person. And values as a whole could be a whole podcast episode on its own, but the basic idea is that we all hold values about what's important to us in our lives and what's important to us as people. And those values might remain really consistent for long periods of our lives. They might change depending on what's happening. And they might vary depending on what part of our lives we're thinking about. So somebody might have different values in their job compared to the values that they have in their family or in their community or in their leisure time or in their friendships, then again, there may well be overlapping values in different areas, but it might be that you have some values in certain areas and not so much in others. And again, there are some really, really helpful resources out there if this is an area people are interested in looking into more for themselves. But in terms of thinking about uncertainty, working out what your values are right now can be really helpful in terms of thinking about what you want to be working towards or thinking about or prioritizing in your life that's really important to you despite uncertainty. And then thinking about what kind of things do you want to be doing day to day that might be goals that you can work towards despite uncertainty. And again, this can be really difficult. I'm not saying this is easy at all. And again, this might be where you potentially, if this is something you're interested in, you might want to seek support from somebody else to think this through. But just as an idea to get started, thinking about, okay, what are my values? What's most important to me right now? What are the things that I most care about? And how do I want to be in those areas of my life? So for example, somebody might say, the one I mentioned earlier, what's really important to me is being a supportive friend. So someone might say, my friendships are really important to me. And actually the kind of friend that I want to be is a supportive one. That's one of my top values. And so what does that look like? And that might change throughout time or depending on what's happening in terms of your life and the level of uncertainty that there is right now. So for example, say you're on the transplant list, you're waiting for a transplant and you think that could be happening really, really quite soon. Sometimes it can be difficult to plan concrete things, which you know are definitely going to happen. So you might think, I really want to go on holiday with a friend because they're going through a difficult time, but actually I can't do that right now because of the uncertainty around transplant. But what are some other ways that I can live that value of being a supportive friend that are flexible to the situation that I'm in with uncertainty around transplant? And that might be, okay, well, we can't do the holiday idea right now, but I know that I can call them once a week to check in on them and catch up. Or I can send them a card, or I can message them on WhatsApp now and then. And those are all other ways of being a supportive friend, if that's your value, that are more flexible and adaptable to that uncertain situation than that other potential goal of going on holiday together. So that's one way that kind of thinking about your values and thinking about what can you do which is living in line with your values despite uncertainty and just be a helpful approach at times of uncertainty.
I seriously like all of these strategies. I think they're so helpful, so practical, and yeah, I'm all for it. So do you have a final strategy?
Again, I would say this isn't so much a strategy, but I think it's just so important in thinking about chronic health conditions is that aspect of peer support. And, you know, I think this is something that your podcast is really helpful with, Dee. That definitely counts within that peer support aspect of connecting people with others who are in similar situations and connecting to those experiences that even if the uncertainty element might be different for different people, depending on where they're at in terms of their diagnosis and treatment and things, actually having support from other people who really get it and who completely understand how you're feeling and where you're at in terms of lots of different issues, but definitely uncertainty is one of them, cannot be underestimated. I would always encourage people, again, it's not for everybody, but I think a lot of people really benefit from peer support and talking to others.
I'm definitely a strong advocate for peer support for obvious reasons. And thank you for what you said about the podcast. I mean, it's certainly what we're trying to achieve here when it comes to the podcast. And as the expression goes, who feels it knows it. I draw so much strength and encouragement from fellow kidney warriors. So yeah, I definitely believe that peer support is a strong strategy for navigating this journey as a kidney warrior. What resources are there available, websites or books, etc., that would be helpful in terms of managing uncertainty?
So, in terms of books, I don't know if you've come across the Reading Well agency, but it's basically a list of books related to health, well-being, mental health, which have all been read and recommended by healthcare professionals. And it really helpfully, they split the list into books for children, books for adults, books for teenagers and young people. And there's some general ones on there around worry and anxiety, which overlap with uncertainty. So they could be really helpful to have a look at. And they should all be freely available from your local library. So libraries team up with the Reading Well agency. So they're free to access all over the UK. In terms of mindfulness and some of those unhooking strategies we talked about, so apps such as Headspace and Smiling Mind, which I'm sure people may well have heard about, they can be really helpful in terms of if you're the kind of person who likes hearing somebody else talking through unhooking type strategies and strategies for the present moment, that present moment awareness, those can be really helpful to use with that. So in terms of the values that we talked about, there's a really good series of books by doctor and therapist called Roz Harris, which all relates to this idea of values and unhooking. And he also has a really good series actually on YouTube of short, very accessible and really engaging animations talking about some of those ideas. So if you look up Roz Harris, Values versus Goals is quite a good one. But he also has lots of videos related to all these ideas that we've been talking about today. And then I would say I've given lots of strategies, but as I said at the start, and as you've mentioned, Dee, just knowing that you don't have to do this on your own. If some of these strategies work and you find them helpful and you want to have a go and play around with some of them, that's brilliant. But please don't feel like you have to manage this on your own. There are always people who are able to support you. And the first port of call, if this is related to CKD, would be your kidney team. So if there are worries that are coming up a lot, as I said earlier, for some people, finding out more information can be helpful in itself, even if there's still that uncertainty there. So speaking to your consultant, speaking to the nurses in your team, and just a really simple strategy with that. Sorry, back to strategies, but it's just writing down worries or questions in between appointments, which I'm aware lots of people, I'm coming from working with children where this can often be a new idea. I know lots of adults will be doing this routinely anyway, but just that kind of simple reminder can sometimes be helpful. Asking about psychology support, either within your renal team, or there might be services within your area that they can signpost you to and support you to access, if that's something that you would like to explore. If you have a child with chronic kidney disease, then actually, again, asking about psychology support within the renal team or speaking to school. So sometimes schools have mental health school teams that they can access or other forms of emotional support. It really varies school to school, but they should know support that's available there or within your local area. Again, that would really vary, but there should be something available. And then for anyone age 16 and over, your local NHS talking therapy service, if you literally just Google NHS talking therapy service, then you can put in your postcode or your town and they'll signpost you to the website. And usually you can just fill in a form or give them a call and find out what they have available in your area. And lots of those services have specific groups or resources available for people with chronic health conditions such as CKD. So having a look at that, and then there may well be potentially groups around worry or resources around worry in particular as well. And again, I have to say this as a healthcare professional, but if you're just really you're really concerned about your own mental health or your child's, then please speak to your GP, including out of hours GP, for more kind of urgent support.
And I'll put the links to all of this in the description box. We've really covered a lot of strategies in this episode. We've looked at grounding, 5, 4, 3, 2, 1. We've looked at scheduling worry, the worry tree. We've looked at where your values are. And we've looked at resources, including the Reading Well agency. Lots of information there. And as I said, I'll be putting the links in the description box for anybody wanting more information. So my final question is, what is your final word of encouragement for the listeners?
I would say that uncertainty can be really difficult and really challenging. And it is absolutely not your fault if this is something you find difficult. It's really, really understandable. And uncertainty is something that can come up at lots of different points. And particularly when you have a chronic health condition or CKD, there's potentially a lot of uncertainty to manage. But there are things and ideas that might be helpful to try. And actually, something that I was thinking of is how, so some people that I've worked with have said that thinking about uncertainty in relation to CKD and ways to manage it in relation to their kidney condition can be transferable to other types of uncertainty in life. And so developing these skills can also be helpful in other areas outside of CKD as well. But please ask for help and support. Don't feel like you have to do this on your own. There are always people out there who can help you.
Thank you so much for joining me. Thank you so much for sharing so many practical, helpful strategies to manage uncertainty. I know this will help so many people, and it certainly will help me. I know that for sure. Thank you so much for all that you've shared today. Thank you so much.
Thank you, Dee. It's been a pleasure.
Thank you for listening to Diary of a Kidney Warrior podcast. And don't forget that you can contact me on social media using the handle Diary of a Kidney Warrior. Please do subscribe to the podcast, and please do tell a friend. New episodes of this podcast are released every other Monday. Until next time, take care and choose to live.
Diary of a Kidney Warrior, sharing faith, knowledge, hope, and love.